Laid out on the operating table, it's enough to scare parents to no end. But an Ozarks couple agreed to put their infant under the knife to save him from a troubled life down the road. Be warned, this operation is a little graphic. Here's tonight's personal portrait.
Hi, Mommy.
He loves his sisters.
Nearly 3-month-old Matthew Hodson is one loved little boy.
Yeah, baby.
He's happy and healthy, with one exception.
You have a long, skinny head right here.
Matthew has a condition that affects about 1 in every 2,000 live births.
Craniosynostosis.
That's a long name.
Yes.
This means part of his skull fused prematurely. In turn, as his brain grows, it pushes to the front and the back in sort of a football shape. This deformity could mean a social stigma down the road, even brain damage.
They said it was fixable and wouldn't be a life or death situation, and it was a pretty easy decision.
Are you nervous? Oh, yes. Yeah. Very nervous. I've never been through anything like this before. You know, when they're going to take my baby away from me.
Pediatric surgeon Dr. Sami Khoshyomn and reconstructive surgeon Dr. Bharat Shah of St. John's Hospital took baby Matthew into this operating room.
So this should be open.
There should be a crack in there like these.
Khoshyomn cuts away the fused skull.
But that's the only part of the surgery that has my heart rate up, you know.
And Shaw reshapes Matthew's head, everyone carefully avoiding major veins and arteries.
And this is a tiny brain and a tiny skull.
And bear in mind, losing even a little blood in an infant could cause terrible damage.
Despite the risks, the team is confident. They replace the fused bone with flexible, dissolvable plates and screws so that Matthew's skull can grow normally. In Matthew's case, everything goes according to plan.
I feel honored to be able to do it. I feel honored to be part of those babies' lives.
I think we're good.
Their parents are so happy to see that change.
We'll wrap it up. Are you excited?
Yes, I'm very excited.
I just want to see him. That is the same baby I saw last week.
It's baby Matthew.
Only 72 hours after surgery, the Hodsons don't just see Matthew, they take him home. With just a little swelling and one impressive scar that hair will eventually hide.
And it was amazing how much difference he looked that morning right after the surgery was over. You could already tell the difference.
He was ready to leave.
So you're glad you did it?
Oh, yes. That morning we didn't know when they were taking him off. That was pretty scary, but we're so glad it's over with, and it's such a relief off our shoulders. I feel like a different person.
Brilliant. Well, Doctors Khoshyomn and Shah say this procedure is best done at a very young age because it's much riskier as people get older. And they say oftentimes adults with this craniosynostosis go into a near seclusion due to their appearance. Now, the Hodsons are just glad that they could get that procedure done here instead of out of town, because people used to have to go to Kansas City, St. Louis, somewhere and pay all the expenses to stay, and it's very stressful.
Modern medicine's amazing, I tell you. What a happy little guy. I mean, a couple of days after having that surgery.
3 days later, I go over there, I think he's going to be all bandaged up. He's great. He looks just like he did other than the scar. And they said, you know, when they opened his skull, you could see his brain just relax.
Very good.
And now he'll have a perfectly shaped normal head just like every other little boy.
Wow, that's a great story.